I am Dr. Vijay Prasanna Parami, rheumatologist, City Neuro Center, Hyderabad. As you all know, City Neuro Center is a renowned institute for neurosciences. We have extended this department of rheumatology or included this department of rheumatology into City Neurosciences. And what actually rheumatology is and who is rheumatologist and what rheumatologist deals with. I am here in the next couple of minutes to talk regarding this aspect. Rheumatologist is a specialist who is trained adequately to detect all the rheumatic diseases in the early stages to prevent crippling deformities and associated morbidity with these diseases. What actually are rheumatological diseases are? Of late we have been seeing many patients diagnosed with a type of disease called as arthritis. This is not a new disease, but many of us are not aware of this disease. Not only among the general population, but also among the medical fraternity, there is a lack of awareness regarding these rheumatological diseases. This lack of awareness regarding rheumatological diseases leads to significant morbidity and mortality associated with these diseases. So what are the type of rheumatic diseases generally a rheumatologist deals with? We deal with a plenty of rheumatological conditions. For example, to start with a common disease called as rheumatoid arthritis, followed by systemic lupus erythematosus, simply called as lupus, ankylosing spondylitis, systemic sclerosis, Sjogren's syndrome, spondyloarthritis, gout, age-related degenerative changes such as osteoarthritis, osteoporosis. We are also specialized in treating and diagnosing life-threatening conditions called as vasculitis, be it a primary vasculitis or a secondary vasculitis. Rheumatologist is also trained adequately to diagnose arthritis in children, which are commonly called as childhood arthritis, which includes a variety of conditions commonly seen in adults too. These include juvenile idiopathic arthritis, juvenile lupus, juvenile spondyloarthritis, psoriatic arthritis in children, and spondyloarthritis in children. Apart from this, we also see hemoglobinopathies associated arthritis or malignancy associated arthritis, so on and so forth. And the next question is, whom should a patient consult when they have joint pains? Whenever a patient have joint pains, patient approaches an orthopedician for the joint pains. This is because again due to lack of awareness regarding the rheumatological conditions. So orthopedician is a person who is trained to do specialized surgeries like knee replacements or arthroplasties. But rheumatologist mainly deals with the medical aspects of this condition to prevent the stage of getting these replacement surgeries. So any person with joint pains or body pains or having some type of skin rashes, which I am going to narrate, they should approach rheumatologist as early as possible. So coming to the symptoms of rheumatic diseases, these symptoms they overlap with many of the non-rheumatological conditions, because of which the diagnosis will be delayed, particularly in early stages. But it is very imperative to diagnose them at an early stage, because early diagnosis and prompt initiation of the treatment prevents the morbidity associated with these diseases. So many of these patients suffering with these diseases, they mainly have non-specific symptoms like weight loss, sense of feverishness or decreased hunger, or body pains or arthralgias, which are called as joint pains. They overlap with non-rheumatological conditions such as infections like tuberculosis or hepatitis or cancer-related symptoms. Because of this, there is a delay in diagnosis and approach to a rheumatologist. Coming to the specific symptoms, these patients has variety of skin rashes which may be or may not be associated with pain, may or may not be associated with itching. This rash is of varying types, involve any part of the body, starting from a pinkish dot-like rash to a confluent rash leading to ulcer or distal ischemia. Apart from this rash, the commonest symptom is joint pain with or without swelling and with or without change in color. The color changes generally we don't observe in Indian complexion, but these are very common in fair complexed people. Along with this, these patients also find difficulty in getting up from the bed or difficulty in turning sideways, difficulty in getting up from squatting due to associated muscle weakness. These patients can also have ulcers in the mouth which may or may not be painful. They may have acute painful red eye, hair loss, and profound sweating or weakness, a sense of severe fatigue. At times, these patients do also have symptoms associated with other organ systems. For example, if cardiac system is involved, these patients may present with a chest pain which is similar to acute myocardial infarction, which is commonly called as heart attack. These patients, they can also have hemiparesis or quadriparesis, which is commonly called as stroke. Chronic non-healing ulcers is also a feature of rheumatological diseases. And one of the common symptoms most of the time we observe is Raynaud's phenomena, which is described as change in color of fingers or toe tips on exposure to cold. Patients will have a sense of tingling or numbness on exposure to cold, followed by change of color of fingertips or tips of the toes to either white or pale or blue or blackish in discoloration or reddish in discoloration. Unidentified in these early stages, they may lead to severe distal ischemia and gangrene of fingers and toes, which may lead to auto amputation of fingers and toes. These patients, they can also have a sense of tightness of the skin, severe acid reflux or alternating diarrhea or constipation, heel pains. These patients may have swelling of entire finger or entire toe. Particularly younger males may have a back pain, which is called as inflammatory type of back pain in medical terms. These patients have severe early morning stiffness of more than 30 minutes to 1 hour, difficulty in turning sideways, difficulty in getting up from bed, or difficulty in going to sleep because of this pain. So whenever patient have these set symptoms, the patient should immediately seek consultation with a rheumatologist for early diagnosis and prompt initiation of the treatment.